In Skill Area 5, we're going to talk about temperament and we're going to talk about self-esteem. But let's start with the anchor that we have for you today, and that is, what does self mean to you? And I'd like to invite you to consider siblings that you know and think about how they may be alike and how they may be different. And one of the things that we want to think about in terms of differences is how our temperament helps us, makes us unique. And temperament is defined, I always go to the dictionary when I have a question like this, as a person's or animal's nature, especially as it permanently affects their behavior. Now that's pretty critical. It's their natural way of being, and it permanently affects their behavior. So I like to think of temperament as how we come, just how we show up in the world, and how we would prefer to operate in the world if we could operate without necessarily dealing with all those other pesky human beings. And I also like to think about it as our comfort zone. So let's talk a bit about comfort zone. We all know where we feel safe and comfortable. In the recliner and with the remote handy, perhaps, that's our safe place. That's where we would like to retreat whenever we feel threatened or when we just want to feel cozy. Outside of that comfort zone, we have another zone that we think of as the growth zone. And that's where we take a risk to leave that comfort zone and operate a little bit differently than we would normally if we were sitting in the recliner. Now, that's a very rich zone, a very happy place to be, and we want to encourage our kids to get there, but we often want to help them dip their toes into that growth zone before they get frightened. Because outside of the growth zone is another zone too, and that's sometimes known as the panic zone. And of course, if we feel panicked, where do we want to go back to? Where we're comfortable and safe. So we want to go back to the recliner. If we enter into an activity too quickly, sometimes we feel that panic. And sometimes if it's a physical activity, perhaps we're stretching beyond the skill that we have, it may also be a danger zone. So this is kind of a good thing for us to keep in mind, and it's particularly in terms of temperament. What we know is that temperament is really where we feel comfortable. And so acting outside of our own temperament is really putting ourselves in the growth zone, and sometimes feels so uncomfortable that it makes us feel panicked. When we feel under stress, for instance, that's when we're in the panic zone or that danger zone, and that's where we want to go back to the comfort zone, and we end up acting just like we would prefer to act, even if that's not the most useful and productive way for us to act. So let's take a look at the growth zone from a different perspective, slightly different perspective anyway. What we want to do is to grow our comfort zone. And of course, every experience we have makes us feel more comfortable with that. In a room, I often ask people, if we were sitting in the same room, if you were coming into class, probably you would take about the same seat most of the time. And it's because we get comfortable in that spot, right? We like to have that spot. But I might ask you to change where you sat so that you'd look at the world from a slightly different perspective. And that would feel uncomfortable for maybe 5 minutes. And then you would adapt and you would create a larger comfort zone and feel comfortable in that spot as well. Well, that's what we want to do. We want to increase our comfort zone and continue to have that growth zone, but then make the panic zone and the danger zone less of an issue for us. So we want to think about temperament from that perspective. We want to help kids gradually learn different ways to operate besides what they're most comfortable with. And so we want to meet them where they are and then help them gradually grow that level of comfort beyond where they are. Now let's get more specific about children's temperament and think about that. And this information comes from a book by Stanley Turecki. It's called The Difficult Child. I'm guessing you might have some children that you might think of as difficult from time to time, or at least their behaviors may be different and difficult for us to deal with. So Turecki talks about having 9 temperamental characteristics, and we're going to go through those in just a bit. But what he says is that some of those characteristics are more difficult than others. And it's really, the issue is the fit between, let's say, an adult who's caring for a kid and the kid. And so if we have different temperaments, we may be finding a difficult fit. Or sometimes our temperaments are too alike, and we might find that to be a difficult fit. So it's the fit that matters. Whatever the characteristic is, if we can fit to the child, then that makes a difference. Okay, so let's take a look at his 9 temperamental characteristics. And this is a handout that you have that I have put below here, and I actually want you to do something with that. But let's go through each of these different characteristics so that we understand what we're talking about. So first off is activity level. So that really has to do with how active or restless you may be. So if you have a child, for instance, that's very fidgety, that activity level may be pretty high. Or if you have a child that's very calm and hardly does anything, that activity level may be kind of low. I want you to think about this from yourself, your own perspective, as well as from a child's perspective. Distractibility has to do with how easily we can pay attention. So if we are, completely unfocused, then we're high distractibility. But if we have an ability to focus and pay attention, then we can do that. We can call that more a low distractibility. Intensity is an interesting one to try to define. Intensity is hard to define without using the word intense, but we kind of know it when we see it. And one of the characteristics there that we identify is how loud we might be when we're either happy or upset. And so that's just one way we might identify it, sort of a behavioral clue that this might be an intense person. So very loud might become very intense. Maybe bothered by a lot of things. That might be kind of intense as well. And then sort of adaptable and not so loud might be more on the low intensity. Regularity has to do with all kinds of bodily functions. So it's predictability in terms of patterns of sleep and appetite and other bodily functions. And so it's very regular is you want to eat your meals at the same time every day. And so you're regularly hungry at 1 o'clock in the afternoon. And that's when you want to eat your lunch. And so it's a regular thing. Highly irregular, however, might be that you're just kind of all over the map with this, and you don't sleep at the same time every day. Sometimes you sleep late, sometimes you get up early, sometimes you stay up late, sometimes you go to bed early. It's just all over the map. It's not predictable in any fashion. And of course, you see a continuum, that there's a medium range there too. But usually we have a tendency towards one higher or the other. Let's see. Persistence has sort of a flip coin there. From a positive perspective, persistence has to do with perseverance. And so once you get involved with something, do you stick to it till you see it to the end? But on the flip side of that coin is the negative side, and that's where you might become relentless or stubborn about getting something that you want. And so, again, we have that range. Being very high persistence, both with the positive perhaps and the negative. I think they often go together. Or low persistence. Now the sensory threshold has, focuses on all of the senses. And some of us are very attuned and stimulated by particular senses. So you have a list there. Is noise something that you hardly notice, or is it something that really bothers and overstimulates you? And I know for myself, this noise, sort of a general loud noise and continuous loud noise, is a little bit different than a sudden loud noise. So that, you want to take that into consideration. Bright lights. I've known some people that really were very bothered by bright lights, so much so that they really wanted always to have the light in their office area, for instance, off, because that bothered them a lot. Or is that something you just don't even notice? You don't pay attention to? Do you have a sensitive nose? And or are you not cursed with that sensitive nose? Do you have a high pain threshold? Or does any pain really, really bother you? Are there certain tastes that really bother you? Or are you kind of medium range there? It's not something that troubles you. And then there's the texture and feel of clothing. There are some of us who have real trouble with a tag at the end, at the back of our necks, or even in the side seam, perhaps. That just really irritates us and doesn't feel good, and so that would bother or overstimulate us. And others of us don't notice such things. Some of us need to have clothing that's very soft and kind of well washed, and some of us are not bothered by that texture and feel. I've known one former student who really had a terrible thing about fleece. She just hated fleece, where other people often might like that. So again, there are different ways that we're different. Approach withdrawal is a characteristic that has to do with an initial reaction to something that's new. So that initial reaction into that growth zone, for instance, that is, do you really like it? Do you love to try these new things? Do you like putting yourself out there and feeling that sense of excitement and risk? Or is it something that you really shy away from? That's the preferring things that you know. Adaptability is like that too, but it's over time. So it's how do you deal with transition and change over time? So once you've gotten used to it, do you really like it or do you hate it? Or is it okay? And sometimes that's going to be situational, we know. And then mood. We talked about mood in terms of optimism, I think, and pessimism. We talked about a general pervasive negative mood. And so is the mood not necessarily negative, but is it somber, perhaps? Or is it lighthearted? I think of two siblings that I observed in a program once, and the older girl was much lighthearted, very lighthearted, and very easy to get along with, and very the kind of mood that really welcomed other people to be around her. Her younger sister, on the other hand, was much more somber and much more likely to observe what was going on before she would participate in it. So not only was her mood somber, but she had an approach withdrawal kind of thing that she really preferred things that she knew. She wasn't going to try something until she usually saw the older sister try it. So this kind of a scale is a good way for us to get to know some folks and to think about how that temperamental fit might happen between us. So what I'd like to have you do is to consider a fit between you and any child in your program. So I want you first to take this form and predict your own temperamental characteristics as best as you can. And then I'm going to ask you to choose a child that you observe and predict his or her temperamental characteristics and compare those with your own. And so I'm going to ask you to describe that and talk about that because that fit is a very useful thing. And again, we want to do a variety of observations because this particular tool that I'm sharing with you is one lens we can use to learn about children. We tend to anytime we look at something, we tend to look at it from our own frame of reference, and this is a perhaps a new frame of reference for you to consider as you're looking at the children that you serve. It's one potential observation tool. Now, that's something I want to talk a little bit more about because I want to think about why we observe children. And certainly we observe them to get to know them. Again and again, I've said know your kids, right? Know the children that you're serving. The more we know them, the more we can predict what they need to meet those needs. We can anticipate what their reactions may be to certain things. We can help guide them better. So get to know your children. So observing children is an important thing about that. It helps us develop a program that's really focused on meeting those kids' needs and really identifying how we can do that better. And to meet kids' needs and to learn how children like to be treated, who want to be treated. And we can also observe to measure the changes that our program causes. So I like to suggest that we observe early in the school year so we get to know children, maybe mid-range so that we can compare what we know about the children now versus what we knew about them at the beginning of the year, and also maybe what changes they've gone through over that time, and then again at the end of the year, again to sort of sum up how has this child grown during the time that they're with us. That's a great way for us to be able to justify what we are giving to kids and how we are serving them and what the worth and value of our program might be. Now let's talk about how do we observe. Well, I think that has to be done systematically. So I might suggest to you that once a week you're going to observe one child, or that you delegate so that every child in the program is observed by somebody in, let's say, a 2-month period. And then they come back and observe that same child again. And it really needs to be a focus on that child during a whole day. So you see a whole scope of that child's experiences in a day. Now, do I know that you can't focus just on that child? Of course I know that. That you're going to have to focus on the group of children, absolutely. But you kind of keep a special eye out for that kid and notice what that kid's doing. And make a point to record what you see. If you don't take notes about what you're seeing, you'll probably forget, or you'll probably maybe mix up when it was you saw this happening. So record what you see, and as you're recording it, do what I ask the advisors to do, and that's to describe what you see rather than to interpret or evaluate what you see. Just give a description and let the evaluation just, sort of dissipate and don't pay attention to that notion that this should be something that to evaluate. Just describe what the behavior is that you see. So I think a systematic observation practice is really, really important in our program. And there are several standards that talk about observation practices. So if you don't have an observation practice, and I know it's a hard thing to fit in, try to figure out how to make that happen. And again, think about how do you develop a system so that you keep coming back to the children. Now, one of the things I know is that frequently observations do happen with children who are a little itchy and challenging for us. And that's fine. We should be observing those children. And we should also be observing all of the children. We need to know all of the children, and we need to know as much as we can about them. And our whole program serves all of them. We need to make sure that our program is fitting all of them. Now, as we observe, I think it's useful to use different lenses. We see different things if we take a wide-angle lens versus a telephoto lens. We see things differently there. So there are a variety of lenses that I either have or will provide for you. And one of those is the developmental asset list. Remember, I asked you to observe and predict how many assets a child had in your estimation about the developmental assets that we talked about in skill area 2 under child development. The temperamental scale is another lens that you can use as well, again to help to know the children and then to identify where we may not fit so easily with that child. And of course, from an adult perspective, it's our job to fit to the child and then gradually help the child learn some skills that will help them expand their comfort zone and expand their ways of being able to work in the world. And then we can also turn to a very simple kind of a scale like this one, which just identifies very specific things that that we're asking. Is this child able to handle this? And does he follow directions? And will he take criticism without complaint? So we're looking at a variety of possibilities for different lenses that we might use to look at children. And the big thing that you need to do is decide on a system or a couple of systems that you might use. Now, for resource file, item 27 does ask you to obtain an observation tool. If you already have one that you use, that's great. Think about, does this give you the information that you really want to have? And you're going to record that information about the child's behavior, but make sure that this tool is not just focused on negative behavior and challenging behavior. You also want to support appropriate program planning. And for the resource file, you're going to have one blank copy, and then you're going to use a copy that you have actually taken some notes on and that you're using, and you're going to include that pretty much to show us that you actually do use a tool. You're not just having this blank tool there, you're actually using it. And then please include a paragraph that says how you use the tool and how do you make sure that every child is observed periodically. Okay, that's going to wrap up our conversation about temperament, and I'll look forward to having you compare your temperamental characteristics with a child's characteristics. And next week we will take a look more at self-esteem.